So for my presentation, I'm going to be talking about multiple sclerosis, otherwise known as MS. So what is MS exactly? Well, it's a chronic inflammatory autoimmune disease that affects the central nervous system. It unfortunately triggers the immune system to attack the brain and spinal cord. And this is caused by damage to the myelin, which causes signals to and from the brain to be disrupted. So on the left, you can see a normal nerve with the myelin sheath intact and the axons firing. And on the right, you can see the MS nerve with damaged myelin sheath and the axons having trouble firing. So what are the causes of MS? Unfortunately, they're unknown. But there is ongoing research in immunology, epidemiology, genetics, infectious agents. With further research, we can understand and find more effective ways to treat and ultimately cure MS. So what are some symptoms of MS? Well, the first known symptom is the MS hug, which is an abnormal sensation in your limbs. You might have walking and gait difficulties. You might notice vision impairments, cognitive changes, depression, fatigue, numbness or tingling in your limbs, and overall muscle weakness. So how does one go about being diagnosed with MS? Well, it goes through a bunch of phases called the McDonald criteria, which usually starts with your medical history, a neurological exam, an MRI, an EPT test, and a lumbar puncture. Then there's about 15% have one or more family members or relatives with MS, so diagnosing is very common. And the ratio of women to men with MS may be as high as 3 to 4 to 1. That's per 100,000 individuals. So what are the stages of MS? So the first stage of MS is the clinically isolated syndrome, CIS. It's the first episode of neurologic symptoms. The second phase is the relapsing remitting MS, RRMS, which is attacks of new or increasing neurologic symptoms. Then we have the next phase, the secondary progressive MS, SPMS for short. It's a progressive worsening of the neurological function. And the last and final stage is the primary progressive MS, PPMS, which is the worsening of neurological function, which is the accumulation of the disability overall. So in this photo, you can see the life scale of the disability of MS. So like at 1, you have no disability at all the way to 10, death from MS. And in between, you'll have, minimal symptoms at 1, 4, significant disability, to 6, walking aid may be required, to 8, you may need assistance with a wheelchair, and 9, you may not even be able to leave your own bed. So what are some treatments for MS? So there's normal physical therapy, occupational therapy, vocational rehabilitation, speech-language pathology, and cognitive rehabilitation. Each one of these play a major factor in treating MS, since it affects almost every part. It can affect your speech, it can affect the way you move, and your daily activities. So what are some medications to take? Well, there's injectable medications, there's oral medications, and there's infused medications. So how does MS exactly affect exercise? Well, exercise can actually be beneficial for MS because it increases strength and balance. However, exercise that is too aggressive can lead to severe fatigue, injury. And it can exacerbate symptoms. During exercise, you may experience numbness and tingling and blurred vision. So those are all signs to either stop or not continue the training for that day. So for my case study, we're going to look at Mrs. M, who's a 57-year-old female who was recently diagnosed with MS. She had noticed recent vision impairment, difficulty walking, and muscle weakness. Mrs. M did exercise in the past, but has not exercised since her diagnosis. She's currently taking interferon beta 1A, which is one of the injectables we talked about, that can affect her exercise level. Other than MS, Mrs. M has no risk and is cleared to exercise. She wants someone to help manage her weakness, coordination, and fatigue. She hopes to learn how to self-manage her own symptoms. So, some special considerations for Mrs. M and any MS patient or client. We want to make sure that we take medications into consideration with exercise testing, training, and scheduling. The individual should be informed how to differ MS fatigue with exercise fatigue. And if the individuals restrict fluid intake because of bladder, since MS affects the bladder, they should be informed to increase fluid intake with increased physical activity levels to avoid dehydration. Some individuals may need written instructions and frequent verbal reinforcement, as since it's a neurological disease and affects your nerves, it could eventually lead to like memory loss. So you want to make sure that you always talk to them about or write down the instructions of each exercise. And then, of course, just like any other disease, we want to monitor for worsening of sensory or motor symptoms during exercise. So, what are some exercise testing we can do for MS patients and our client, Mrs. M? So, one of the ones we can do is a 6-minute walk test assessing exercise tolerance. We could do the timed up and go test assessing muscle function, the functional gait assessment for walking balance, the 10M walk test assessing walking speed, the 5 times sit to stand assessing transferability. So what are some exercise testing considerations we would need for this client and for any MS patient / client? Well, we want to avoid testing during any acute exacerbation of their symptoms. We want to use an RPE scale on the OMNI scale and heart rate to evaluate their exercise intensity for their exercises. We want to perform exercise testing in a climate-controlled room, which is usually about 72 to 74 degrees Fahrenheit. The most common exercise testing equipment that we would use for these clients are a cycloergometer and the armorgometer. Since walking can be tough for MS patients, we want to make sure we have them on like more stationary sitting sort of exercises for testing. We want to closely monitor for any symptoms as exercise intensity increases, just like any other chronic health disease. And then here's a picture of the RPE scale that they would use. So 0 is extremely easy, all the way to 10 extremely hard, and we will use this scale to help perform our exercise prescription, to help write that down for them. So for our exercise prescription for this client, we're going to have aerobic resistance and flexibility. The frequency for aerobic is going to be about 2 days a week, and her intensity is going to be 40 to 70% of her heart rate maximum. And the time is going to be about 10 minutes before increasing to about 20 to 30 minutes. For her resistance, her frequency is going to be about 2 days a week. Her intensity is going to be about 60% of her 1 RM. And her time is going to be about 1 set for every 10 to 15 reps, depending on how she's feeling. And for flexibility, that's going to be the most frequent, as it is important for MS patients to have flexibility. So that's going to be about 5 days a week. And her intensity is just going to be stretched to the point of tightness or discomfort. And then for time, we're going to do about 2 to 4 reps and hold for 30 to 60 seconds for each exercise. So these are some of the exercises I picked for our client to do that are most common for MS patients. So for aerobic, we're going to do the cycle ergometer and the arm ergometer. For resistance, we'll do simple exercises, body weight squats, shoulder press with light weight, resistance band arm curls, resistance band triceps extensions, and sit to stands. And for flexibility, another set of really easy, pretty beginner style stuff for MS patients. Arm circles, child's pose, butterfly stretch, seated hamstring stretch. So what are some considerations when doing exercise prescription and exercise training with MS patients? Well, we don't want them to be exercising when they have an exacerbation of symptoms. So during an acute exacerbation of MS symptoms, we want to decrease the fit principle of what our exercise prescription was to a level of tolerance for that individual. We want to increase rest times if needed, as fatigue increases, about 2 to 5 minutes. To eliminate balance issues, flexibility could be performed seated or lying down. It's most common to have them seated or lying down because you don't want them to fall or risk another injury. During stretching, muscles and joints might require a longer hold duration compared to what I've written in my exercise prescription. It's just based off of whatever the individual really feels needs more work. And then in conclusion, overall, MS is a major disease that affects nearly 2.8 million people worldwide, and unfortunately there's no cure. But through exercise we can help treat the effects. My key takeaways I hope you got from this presentation are: we need to perform more research to find the cause of MS. Since it's unknown, it's almost like cancer. We don't know what causes it. Well, we know what causes it, but we can't cure it. I want to, perform more research on benefits of exercise for MS. See what exact exercises are the most beneficial for MS patients than just writing regular exercises for prescribing. And how exercise can be beneficial to MS if prescribed correctly. And overall, I hope you learn more about how MS affects the body and how to properly prescribe exercise to MS patients and clients. These are a list of my references, and that's it.